Okay, I'm going to describe single payer for you, and then managed care. Single payer has two elements. It means one payer replaces multiple insurance companies, and secondly, that one payer is given the authority to set limits on fees that doctors can charge, that hospitals can charge, and the prices that drug companies and equipment manufacturers can charge. So two elements. One payer replaces 1,000 insurance companies at the national level, or 200 or 300 here in Minnesota, and that one payer has the authority to set limits on what people charge. At the national level, those two elements could probably cut spending by 20 to 30%. And it's probably half and half. Both elements reduce administrative waste, and then when you limit charges, you can probably reduce costs further. Let me just say that a little more clearly. The reduction in administrative waste is probably on the order of 10 to 15% of our healthcare bill. Overnight, that would happen. By reducing prices, which is the authority given the single payer, you probably can save another 10 to 15%. And so a good estimate of total savings, and mind you, I'm not folding back in the question of how much would it cost to insure everybody. For now, I'm just telling you what the savings are. The total savings are somewhere between 20 and 30%, evenly split probably between reduced administrative waste and reduced fees and prices. Let me talk briefly about where the administrative waste is so that you grasp why a single payer, and only a single payer system, can reduce all this administrative waste. If you give an insurance company $1 worth of premiums, the insurance company will keep 20 cents to run its shop for overhead, for administrative costs, and pay out 80 cents to doctors and hospitals. If you give Medicare $1 worth of taxes, Medicare keeps 2 cents to run its shop and pays out 98 cents to doctors and hospitals. Medicare, despite what some people say about it, is our most efficient health insurance program, public or private. Now, I'm not talking about the Medicare Advantage portion of it. That adds a wrinkle we don't have time to talk about. But the traditional Medicare program is extremely efficient. If you think about it, and I won't stop and ask you to tell me, but I'm pretty sure if we stopped, we went around the room, you would tell me what is it that Medicare is spending so little on that the insurance companies are spending a lot on. I'm just going to run through the list. Sales and marketing. Medicare doesn't advertise at halftime in the Super Bowl. The insurance industry does. Revenue collection. Medicare can just piggyback on existing tax programs. The insurance industry has to charge premiums and collect them. Creating networks. Medicare doesn't make you choose a network. And then if you make a mistake, go to the wrong hospital, bill you for it. The private sector does that. And it's expensive to negotiate a new network every year. But the insurance industry does that. Utilization review and micromanagement. Medicare doesn't play Captain May I, make their doctors play Captain May I. Dear insurance company, can I hospitalize this patient? Can I give this patient this statin or that statin? And so on. Medicare doesn't do that, and if you want Medicare to do that, or any insurance company to do that, you got to pay people to argue with the doctor. Medicare doesn't underwrite, which means they want to know, the insurance company wants to know your health history. Medicare doesn't pay exorbitant management salaries, doesn't pay for lobbyists, and it doesn't have to make a profit. If you're not paying for all that stuff, you can run a very lean shop. A single payer system gets at that waste overnight. Now, at the national level, probably 30% of everything we spend on healthcare, the $3.3 trillion we spend on healthcare at the national level, of that, 30% is for administrative costs. Now, you can't say all of that is waste. A high school choir has some administrative costs. Any human enterprise has to have some administrative costs. The issue is, do we really need to spend 30% of our healthcare dollar on administration? The answer is no. If you got to a single payer system, you could probably cut that 30% in half. And that would save an enormous chunk of money. You could then cover everybody and have a big party. The provider sector, hospitals and doctors, also enjoy a reduction in administrative costs when you go to a single payer, because they're not dealing with multiple billing codes. They're not being forced to play Captain Mayo. Here's a quick statistic for you. The typical American hospital will spend 25% of its revenues on administration, 25%. The typical Canadian or Scottish hospital, both of which are in single-payer systems, they pay out 12% of their revenues to overhead. So when I say that we can cut the 30% we spend on administration now in half, I mean we're going to reduce both the insurer sector administrative costs and the provider sector overhead costs. At the state level, now remember I just said at the national level we could probably cut costs by 20 to 30%, but at the state level we can't count on that big of savings. We can count on the administrative waste dropping dramatically overnight. But when you think about, for example, a Minnesota single payer negotiating with a drug company, Minnesota has 5.5 million people in it. The nation has 320 million people. A national single payer is going to have a lot more clout in negotiating with a drug company than a state will have. And so you just can't count on a state single payer being able to reduce fees and prices quite as far down as a national single payer would. And so I think a good number to use in thinking about how much the single payer at the Minnesota level could reduce costs by limiting fees and prices, that number is probably around 5%. Okay, so imagine, Minnesota could save 10 to 15% overnight on administration and another 5% by further reducing prices, for a total of somewhere in the range of 15 to 20. And that's more than enough to cover everybody and to pay for some long-term care as well. Now notice in this, 10-minute description of single payer, did you hear me say, and by God, single payer will get at all that overuse? I didn't say that, because that's not what it's geared at. It's geared to reduce prices and the waste that drives prices up. Dozens of studies have shown, I don't have it up here with you, dozens of studies have shown, including the growth and justice study that I know you guys heard about a couple of meetings ago. Dozens of studies have shown that a single payer system can reduce costs so much that it can cover everybody and either cost the same or reduce costs. Dozens of studies have shown that. No study has ever shown that universal coverage with either a high deductible system or managed care can do that.